Hi, I'm Isabella Galichia,
And I'm Dr. Jody Galichia.
and in today's video, we're going to be talking about COVID-19 and its after effects on your heart.
Well, COVID-19 has changed our lives immensely. It has had an impact that is huge for people who get the disease and for all of us who worry about getting it. And then, of course, people who now have these lingering after effects of COVID. And one of those relates to the heart, because it's been shown now that some percentage of people, maybe 10%, maybe 12% of people who've had COVID have a tendency to have inflammation in the heart muscle. They may have decreased contractility of the heart, so it's affected the heart's ability to pump. There are a lot of things that can go wrong, and one of them is a heart rhythm disturbance. Atrial fibrillation is common. I have a good friend who was in super health and worked out every day, did a good job of taking care of himself, and got COVID and then got over it pretty quickly, but then right away said, geez, my heart's beating too fast. And he had atrial fibrillation. So that is another problem and that we're seeing is people who get COVID may have a heart rhythm problem. They may have a functional problem of the heart. They may have chest pain that isn't even discernible. Can't tell, why they're having the chest pain. Sounds like heart disease. Not sure. There are about 100 symptoms identified now related to COVID. No one has ever seen a disease like this ever before. And the other problem is that of the people who have the lingering effect, the tiredness, the shortness of breath, the chest pain, the heart problems that do occur over a long period of time, we don't know when and if that's ever going to get better. I mean, some of these people have been sick now for 6 months, a year, and they still aren't back to normal. Fuzzy thinking is a problem sometimes. So there are all these symptoms with COVID, and heart disease is one of them. Now, a new thing has come about with the heart, and that is that young people who get a shot to prevent the virus, in some instances develop inflammation of the heart itself. And that is a problem. It's more common in boys than it is in girls, and it's very, very rare. The risk of developing that problem is 1 in a million or so, but the risk of developing COVID itself is much, much higher. So you can't say because of the possibility of a heart ailment of any sort, inflammation of the heart muscle in any age group, if you are able to get vaccinated, whether you're 12 or whether you're 95, you should have the vaccine. That's my opinion, because the incidence of these problems is relatively low, and it still beats having COVID, because you got to remember the people who have COVID itself are the ones who have the lingering effects that damage you for life.
So, if I had a family member or loved one who recently had COVID and has recovered from COVID, what should I tell them to ask their doctor concerning their heart health?
Boy, that's a good question. I think, first of all, if they have no symptoms, let's say, you've been running and now you're back and you're doing everything you did before and you feel great, no shortness of breath, no chest pain, probably nothing needs to be done. But for those people who've noticed a change in their exercise capacity, if they notice a change in their breathing, if they've noticed chest pain, if they've noticed weakness or tiredness, that has to be evaluated. And an echocardiogram may be very helpful to see that the heart has not been affected by COVID. Unfortunately, as I just mentioned, we're not sure when these people are going to get better. But we also know that if, let's say, heart failure is part of the problem, that medication may help the heart to beat better and may make the symptoms better. I think we have a lot to learn here, and it's going to be around for a long time, and we have to be aware of the lingering side effects of COVID.
Thanks, doctor. And thank you for watching. And be sure to visit hearthealthcommunity.com to learn more about COVID-19 and its after effects on your heart health.
Thank you.